Hi, I'm Adrienne and welcome to No Awkward Question. I am a women's health nurse practitioner and this is my channel where I talk about all kinds of things: sexual health, women's health, genital health, all kinds of things that could create what some patients might call an awkward question. And this is my space to remind you that there is no such thing as an awkward question. So what I wanted to cover today was the Nuva ring. I really wanted to go over this because I have a lot of patients who tell me, what's a Nuva ring? When we're doing birth control counseling, I try to go over all the options, and often I'm met with a lot of confusion about what the options are, and the Nuva ring is one that gets missed really often. So let's talk about why first. Why would a provider not tell you about it, or why would you not know about the ring as an option? There are some barriers to starting the Nuva ring, like being comfortable with your body, and being comfortable with inserting something, so that I feel like a lot of times providers will just like skim over that one and just assume that a patient is not comfortable with inserting something, or just assume that someone wants to start with a pill, and they don't even talk about it. So that's what we're going to do today. So how effective, first of all, hold on, back up. What is the Nuva ring? So the Nuva ring, I always compare it to a hair tie. If you've ever used one of these, or thrown one around for your cat or whatever, or been in the unfortunate situation where you have broken one and you look to your wrist and there is no hair tie. It's similar to a hair tie. It is silicone, so it does not harbor bacteria, will not create vaginal infections, but it's silicone, and it has estrogen and progesterone both. So it is what we call a combined birth control method. So it's estrogen and progesterone. So what is it? It is a once a month birth control option. So the way that it works as a once a month birth control option, the way someone would use it, it's silicone, so it's very flexible. So it should be relatively easy to insert once you get the hang of it. It's inserted vaginally for 3 weeks, or talking with your healthcare provider if you're following a different protocol, but about 3 weeks at a time. And then you take it out and you have 1 week off, or you let yourself have a menstrual cycle, something that resembles a menstrual cycle. So in for 3 weeks, out for 1 week, and you get a new ring every month, and you can do that for a very long time. So one ring is a 1 month supply. What is the effectiveness of this birth control method? So when used correctly, the Nuva ring is 99% effective. But you'll often see it quoted, if you were to go Google it or look on any reputable organization, they're going to quote you right around they will quote you right around 93% effectiveness, because there's operator error involved. You could forget to put your ring in on time. You could forget to take it out. You could take it out and forget to put it back in. Many options where you could potentially not use it correctly. So about 93%. I always remind patients that any method when used with another method is more effective. So if you're like, oh gosh, 93 doesn't sound great, then okay, you can use, even the pull-out method is going to add some amount of effectiveness. Not a lot, but it will add some. That type of thing. We can increase the effectiveness past 93%, but using it correctly is the first step. So how to put it in and how to take it out. So once you get the hang of it, it should be very, very simple. But typically, to put it in, most people will just kind of fold it like a figure 8 and insert it vaginally. It kind of finds its happy home and it stays there. It doesn't typically fall out, and it's not going to go anywhere else. That's often people's concerns, like, oh my gosh, what if it goes somewhere it's not supposed to? It's like, where do you think it will go? Where do you think it will go? The vagina ends in the cervix. It's not going to travel somewhere else in your body. As long as you insert it in the vagina, that's where it stays. How do you take it out? I have had patients come in with stuck condoms, stuck tampons, all kinds of things. I've never actually had a patient come in with a stuck Nuva ring they couldn't get out. I've had patients fearing that maybe that their Nuva ring was stuck, but never a stuck Nuva ring. So So pretty simple to remove. I always tell people 2 caveats. One, if you're a little bit concerned about insertion initially, you can actually use a tampon applicator. So you have your tampon applicator, you just take the cotton out and then put the Nuva ring in, and either use some water or some lubricant to make it go in easier, and then you just insert the device that way. It's super simple, super easy, until you get comfortable, and then you can just insert it with your fingers, whatever works best for you. The second caveat there is that you can actually take it out for intercourse if you want. Some people are like, well, no, I don't want to really mess with it, or heat of the moment, I just left it in. That's fine. But if you're concerned about it, you can take it out and put it to the side and put it right back in after intercourse. The real line in the sand is about 3 hours. So it can stay outside of your body for about 3 hours and maintain its effectiveness. So if you took it out and then forgot to put it back in, and then you remember the next day, we've lost some effectiveness, you want to use the backup method. Last but not least caveat on inserting and removing is, if you're really concerned about it, or you're concerned about taking it in and out, your partner can help you. If you're dating someone, you're with someone, then they can help you. That's fine. I've had plenty of patients who are like, I thought I forgot my Nuva ring. I thought it was stuck. So I had my partner feel for it. Totally fine. That's fine. Teamwork. How does it prevent pregnancy? So all combined methods have about a 3-pronged approach to preventing pregnancy. So when we say combined methods, we're thinking the pill, the patch, the ring. Combined method means it has estrogen and progesterone. What those hormones are going to do: 1, it's going to thicken your cervical mucus, so it acts like kind of a plug, so sperm can't get to where it needs to go. Number 2, it's going to keep the lining of the uterus thin, so there's less for you to shed, and that's not a great environment for pregnancy and implant. 3rd is it's going to prevent ovulation most months of the year. So what are the pros? Now, the pros and the cons are going to be similar to the patch and the ring, with some slight differences. The pros of the Nuva ring: number 1, convenience. I like to call it the lowest maintenance set it and forget it method, because it is totally in your control. Low maintenance in the fact that you control it yourself. It's once a month, but it doesn't require going into an office and getting an IUD inserted and checking on that. It's less invasive than an IUD, but it's still kind of set it and forget it, but low commitment in the fact that if you want to stop using it, you just stop using it, versus like an IUD where you'd have to go in and have it removed, typically. So ease of use, set it and forget it. Effectiveness, 93 to 99%. That's pretty good. That's better than just condom use alone, or tracking your cycles alone, or not using anything at all. Another big pro is what it can do for your menstrual cycles. It can make them very regular. It can make them lighter and easier to manage, if that's something that you want. Now, what are the cons? Every birth control method have cons. And the other thing I always tell people is that every birth control method is like a little cult. And the Nuva ring is like its own little cult as well. So when you're in it and you love it and it's working for you, you're like, this is the best. Everyone should do this. This changed my life. So you'll find people who love their Nuva ring and they're like, you can rip this out of my cold dead hands. This is the best. And then you have lots of people who tried it and hated it, or will never try it. So taking everyone's personal experience with a grain of salt. But there are some cons. So while you don't have to remember it every single day like a pill, there's still some remembering and scheduling that you have to do. You have to remember to insert it, when to remove it, and then when to put it back in. You might forget, oh gosh, it's been more than a week, I was supposed to put it back in, oh no. So that is a barrier for some people for using it appropriately. It's not as effective as some other methods like an IUD or sterilization. The other con is it's not an option for everybody. If you have certain health conditions that make it dangerous for you to have estrogen, you can't have the Nuva ring. So what are some of those health conditions that would make you a poor candidate? Number 1, greater than 35, using tobacco products. Your blood clotting risk is too high. You can't have estrogen. That means pill, patch, or ring, but that includes the ring. Migraines with aura. There's a little nuance here, but that's something to talk to your healthcare provider about. If you had them like 20 years ago versus having them currently, a good conversation to have about your risk. A known history of a blood clotting disorder that you personally have, or you have an incredibly strong family history of people getting blood clots, or you have a genetic condition that causes you to clot, or you've had a blood clot in your lungs or in your legs unrelated to any surgery. Again, we're worried about blood clots. Or then certain medical conditions involving your liver, your kidneys. That's why it's really important to give your provider a good health history, to be as honest as possible, because we want to reduce your risk as much as possible. So there are some people who can't use it. The other con is that you have to be comfortable inserting it and removing it. So that can be a little bit of a barrier for people. They're like, I've never inserted a tampon, so using a tampon applicator sounds crazy. Or inserting it with my finger and then having to take it out with my fingers. Oh my gosh, how does one do that? That's okay, but this can also be a lesson in getting to know your body a little bit better, and it can be worth a try. Some people are surprised how easy it is, and some people are like, no, that was never easy, it was terrible. So that's okay, but that can be a barrier. The other con is that when we take away ovulation with any birth control method that is going to take away ovulation, we have the potential to cause some decrease in sex drive. The reason that the way that I explain this to patients is when you ovulate, you have those couple days out of the month where your body's like, oh my gosh, I look great, I feel great, I should probably go forth and populate the earth. Yes, that makes sense. But when we take away ovulation for contraception or for PMS or PMDD or for menstrual management, whatever the reason is, we're using a method that's getting rid of ovulation, we could affect your sex drive. It could be lower. Some people do not feel that at all, but it is something to consider. If that was you, you're like, I love my partner and I feel like I never want them to touch me ever again. That's a conversation to have with your healthcare provider. Or if you felt like it was negatively affecting your mood. There are many people who use birth control methods to help with PMS and PMDD symptoms, and it's a lifesaver. And then there are people who are like, I feel so much better off of my birth control method. I need to find a contraceptive method that works for me. But that birth control that I tried really affected my mood. So these are just things to watch out for. We don't have perfect data that says this is exactly who will experience these mood changes with these specific birth control methods. There is a lot of trial and error involved. So if you're experiencing symptoms that are uncomfortable for you, it's something to talk to your healthcare provider about. So I talked a lot about the Nuva ring because that was the first ring that came out. There was only one. Now there are some generic forms here in the US. If you're abroad, it might be different names, it might be different generics, it might be less available. It's pretty widely available in the US. There is one other ring that we have available in the US now called Anovera. It is a newer prescription in the fact that it's been in the last few years, but it's actually a yearly ring. So I always mention this because this can be helpful for patients who might be losing their insurance coverage or will be traveling a lot or traveling abroad or have a job where they're not always close to their pharmacy. So what is this ring? It's a yearly ring. So with the Nuva ring, the original ring, it's once a month and then you got to get a new ring. So that's not too bad, once a month. But this Anovera is one ring for the entire year. So you could see how that would be so helpful if I said, I'm going to lose my insurance in a month. What am I going to do about birth control? Because the Nuva ring can be really expensive if you have to pay cash for it. Or, I'm a flight attendant and my schedule's crazy and I never know when I'm going to be able to pick up my ring from the pharmacy. Or I'm moving abroad for 6 months, and where I'm moving, they don't have the Nuva ring, and I can only bring so many with me. So there's so many reasons why it can be helpful for patients. So if you're in that situation or you just feel like it would be more convenient, you can ask your healthcare provider about that option if it's available for you where you live. And now you know all about the Nuva ring. And if you decide that it's the right option for you or it's something worth trying, then you can refer back to this video for lots of information. Or you can have an educated conversation with your healthcare provider about the risks, benefits, and indications and why it might be a good or bad idea for you. So don't forget to like and subscribe and share and comment, all the things. And you can also find me on TikTok and Instagram and Facebook and all those great places. And don't forget, there's no such thing as an awkward question.